This presentation will go through some of the terminology used in anatomy. This can be a lot of information to take in, as there are many new terms to grasp, but these just take practice. So why are there so many different terms in anatomy? Basically, they are used to keep language clear and consistent when describing structures in relation to others. This is useful in medical settings as well. It eliminates ambiguous words like next to or near when communicating in anatomy or medicine. When we talk about terminology like this, we use them in regards to the anatomical position. This is when a body is facing forward, with the arms to the side and their palms facing forwards. The legs are in a standing position, roughly shoulder width apart. There are many terms we can use to describe relationship terms. If you check the terminology table, this will have many more listed than what we will discuss in this video. This table is for your own consolidation and to help you if you come across any other terms in your own research that you are not as familiar with. As we go through this, think about two different body parts and use the terminology you are about to learn to describe them. So we have a body in anatomical position to the left and a diagram showing these relationships to the right. The box symbolizes a body in anatomical position. So above we have superior, which means a structure above another. So think, what box will it be in? This box here. Opposite of superior is inferior, meaning below. So what box will it be? This one here. You could say the head is superior to the feet. We have anterior, meaning in front, making it this box. Opposite of this, we have posterior, meaning behind. You could say the kidneys are posterior to the liver. Also, the biceps brachii muscle that flexes the elbow is anterior to the triceps muscle that extends the elbow. We also have terms like ventral, meaning belly, and dorsal, meaning back, which are sometimes interchangeable for anterior and posterior. These are used more so in embryology and human development, where these can actually vary. And finally, we have medial, which means closest to the midline. So if we were to draw a midline straight down the middle of our body, structures closer to this than others will be medial. Therefore, those further away will be lateral. An example of this, the nose is medial to the ears, but the ears are lateral to the eyes. We also have terms relating to if a structure is closer or further away to the trunk of the body. The trunk being your torso, the main stalk of the body. Proximal means closer to the point of origin, or the trunk of the body. Distal means further away from the trunk or point of origin. You can say that the shoulder is proximal to the wrist, or the toes are distal to the ankle. We can also describe structures based on how close they are to the surface of the body. Here we have a cross-section of a thigh, which is the top part of the lower limb. Superficial means closest to the surface, whereas deep means further away, and middle means between a superficial and deep structure. So we have the skin, which is superficial to the femur bone, which is deep, and the muscle, which lies between them, is middle. There are planes within the body that divides it into sections. We can see the main three on this diagram. Frontal or coronal is this plane that equally or unequally divides the body into anterior, front, and posterior, the back, parts. Next, we have the transverse or horizontal plane that equally or unequally divides the body into superior and inferior parts. A sagittal plane, however, is an unequal division of the left and right parts of the body, as a mid-sagittal section is perfectly down the midline of the body, dividing it into equal left and right halves. Lastly, we have the oblique plane, that is the plane that does not fall into these other ones, in which it divides the body at an angle, and is not parallel to these other straight planes. Remember to check out the terminology table for these definitions and others we come across in anatomy. Here are the references for the images used in this presentation. Please check out the supplementary document for further information. Thank you for listening.